Okay, we'll start our session today by talking about the assessment criteria for writing. All right, as we know, the writing task that we will get in the OET exam will be in the form of case notes, as we will see later. So you will be given 45 minutes. In these 45 minutes, the first 5 minutes, you will read the notes, and then in the next 40 minutes, you will be writing a referral or a discharge or a transfer letter, as we will see. And then your letters will be assessed. According to what? According to this assessment criteria. All right? According to this assessment criteria. So first, we will start by the purpose, and then the content, conciseness and clarity, genre and style, organization and layout, and language. So let's take them one by one. Let's leave the purpose till the end because I consider it the most important assessment criteria. So let's start first with the content. The content, I mean by content, which is the important information or the important data that I need to select from the given case notes. Content is appropriate to intended reader and addresses what is needed to continue care. I mean by this that the information or the data that I'm going to select from the given case notes, I have to select them according to what is important for the reader, the doctor to whom I'm going to write this letter, or the nurse or the occupational therapist to continue the care of the patient. This is concerning the first point, which is the content. Okay, after I have selected the important relevant information, we come to the next point of the assessment criteria, which is conciseness and clarity. And I mean by this, the length of the document is appropriate to case and reader. No irrelevant information included. Information should be summarized effectively and presented clearly. What I mean by this? I mean that you might find in the case notes many irrelevant information. Many irrelevant information. This irrelevant information I should omit. I should not be writing them down in the referral letter that I'm going to write. That's what I mean by conciseness. And what about clarity? I mean by clarity that the data that I have selected from the case notes, I have to summarize it because this data is too long. So if I wrote all of it, the word count will be exceeded. To make my point clear, in OET, the words count for the letter that you have to write is from 180 to 200 words. All right, so you reach this number of words from the data that you have selected. So if the word count is less than 180, if the word count is less than 180, that means that you will never get the desired score, which is 350 or the B score. This is the target score that you have to get to pass the writing subtest. All right, so because if you did not reach this number, the 180, that means that there is important relevant information in the case notes that you did not include. All right, so you might find that the word count is 160, for example. That means that there is important information relevant you did not include. But what if the word count exceeded 200? If the word count exceeded 200, for example, let's say 215, for example, this will be accepted. Okay, this will be accepted because there are some case notes which are too long. All right, that's why it's accepted to exceed the word count a little bit. However, if the word count reaches, let's say, 250, this will carry a high risk of not getting the desired score, which is B score. Why? Because this means that you have written all the case notes without summarization that we have mentioned, okay? And another thing is you might carry a risk of mistakes, either spelling mistakes or language mistakes or grammar mistakes, all right? So you need to pay attention to this point. Let's move on. Genre and style. Genre and style. All right. Genre and style. What do I mean by this? Let's see. Writing is clinical, factual, and appropriate to genre and reader. Discipline, knowledge. Technical language, abbreviations, and polite language are used appropriately for document and recipient. All right. So what do I mean by clinical and factual? Clinical and factual, I mean that I'm writing a clinical letter. So there might be some clinical expressions. I should not overuse it. However, I need to express it in a technical way. And that's what we are going to learn during our sessions. That's why I'm saying we have to use technical language. I mean by this, if you are writing a letter to a doctor, it will differ from a letter written to a nurse, and it will differ from a letter written to occupational therapist. And you must use a polite language, especially in the introduction. All right. And we move to the next assessment criteria, which is organization and layout. Organization and layout, it means the paragraphs, how they are organized. And this we will discuss in details during our session, how to organize the paragraphs of the letter. It's important to know that the key information is highlighted and subsections are well organized. So the key information must be highlighted and subsections must be well organized. I mean by this, important information the reader needs to know to continue his care to the patient needs to be written in the first place. We come to the language. The language, I mean here spelling. For sure, if you write spelling mistakes, you will lose marks. Punctuation, vocab, grammar, the verb tenses and the sentence structure, the preposition, and all of this. Sentence structure. Your letter must contain variety of sentence structure. Simple sentence, complex sentence, compound sentence, passive sentence. There's a point I need to highlight here. What is the difference between spelling and vocab? I mean by the difference between spelling and vocab is spelling, I mean the spelling mistakes, the pronunciation of the word, the letters of the word. However, I mean by vocab, rephrasing. I mean, instead of using the words given in the case notes, you have to rephrase, use your own language and your expression. All right, let's move on now to the most important and the most critical point in the assessment criteria, which is the purpose. Let's read it together. Purpose. Purpose helps the reader get a quick and precise sense of what is asked of them. Due to time constraints, health professionals want to understand the purpose behind a written handover document, referral letter, very quickly and efficiently. This criterion therefore examines how clearly the writing communicates the purpose of the document to the reader. The purpose of writing should be introduced early in the document. And I mean by early in the document, in the introductory paragraph. We will explain it later. Then clearly expanded on later. Okay? So let's see this example given. For example, a writer might at the beginning of the letter write, I'm writing to you today to refer patient X who is now being discharged from hospital into your care. Later in the letter, specific instruction for the healthcare professional on continue care. So if we take a look in this letter or in this example, a writer might at the beginning of the letter write, I'm writing to you today to refer patient X who is being discharged from hospital into your care. So to summarize, two important points needs to be mentioned clearly in the purpose. Why I'm writing this letter and what do I want from the reader to do? Why am I writing this letter and what do I want from the reader to do? Why I'm writing this letter? I'm writing to you today to refer patient X who is being discharged. That's why I'm writing this letter. All right? And what do I want from the reader to do? I want from the reader to take care of this patient. Clear? Now we are done from the assessment criteria.